So welcome to our Tiki Tuesday. We are going to be discussing about a left middle cerebral artery occlusion. She came in with an NIH of 22, which means she had very significant neurologic deficits, which included a left gaze preference, right-sided weakness or hemiparesis plegia, and she was nonverbal, very aphasic, both basically global. It was non-communicating, basically mute. She was found to have a left middle cerebral artery occlusion on her CTA, which is the CAT scan that we have here at the top. And then her CT perfusion here demonstrates a significant increase in the bottom right-hand corner in the time to peak, which means how long does it take to get the maximum amount of contrast during that scan to an area of the brain. And if there's a blockage in an artery somewhere, it's going to take a really long time, if at all, to get contrast into an area where that is. So that part looks real hot, looks real red, and that means there's a big delay in flow. We see the increase in the Tmax area, and what's great for the patient is that what corresponds on this cerebral blood volume study is that it looks relatively normal. And what that means to us is that the patient's brain is relatively viable, and that we have what's called penumbra. And that means we have something to go save. So let's get to work. Here we see the angiogram, and we see an injection which has a lot of tortuosity in it. So we used a very kind of novel, very disruptive catheter for stroke intervention, and it's called Send It. And it's called Send It because you just send it. You send it over a microwire, and it makes it so a lot of this tortuosity is just kind of eliminated from the challenge of getting that occlusion out. And we've circled that occlusion here in red where you don't see contrast filling. And one challenge when you're navigating through a carotid artery is getting past the ophthalmic artery branch. And Send It was basically designed to completely pretend like the ophthalmic's not even there. It just blows right by it and gets you to where you want to go. And here we have a nice little clip of our Send It going up. A little bit darker portion is the distal tip of the Send It, and you can just see this thing flies through that very tortuous carotid artery, gets right up to the occlusion. See that the blood vessel is nicely open. We got great recanalization, and the patient did fantastic, which is obviously the most important part. NIH of 0 when she was discharged later. So it's a fantastic outcome, and we did it in 7 minutes. Thanks, Send It. See? That's how it's done. That's how it's done. That's how you do it. That's how you do it. Right there.